Welcome doctors, you already know coding translates patient care into standardized codes for insurance claims. But here's the big question many providers ask. Is outsourced medical coding secure under HIPAA? The short answer: yes, it can be, as long as you partner with the right vendor and have strong safeguards in place. Think about it: medical coding involves protected health information, or PHI. We're talking diagnoses, treatments, patient identifiers. That makes HIPAA compliance non-negotiable. When you outsource, you're inviting a third party into your world, often through EMRs or billing systems. And with that comes risk: data breaches, unauthorized access, or vendors who simply aren't compliant. It enforces the minimum necessary standard, meaning coders only see what they need to code, nothing more. And every outsourcing vendor must sign a business associate agreement, legally binding them to HIPAA. Then, there's the security rule. It requires encryption for all PHI transmission, role-based access controls so coders only get into the coding-related functions, and audit trails so you know exactly who accessed what, and when. That's accountability built in. And don't forget the breach notification rule. If there's ever a breach, say PHI gets sent to the wrong payer, your vendor is required to notify patients, HHS, and sometimes even the media within 60 days. Now, what happens if a vendor ignores these safeguards? The consequences are steep. HIPAA fines range from a few $100s to nearly $70,000 per violation, and annual caps can be beyond money. Breaches damage patient trust and can stain your reputation. So what can you do to make outsourcing secure and stress-free? First, only work with HIPAA-trained coders who keep up with the latest code sets like ICD-11 and CPT. Second, ensure they use secure, encrypted coding platforms that log every action. Third, choose certified vendors with HIPAA, SOC2, and ISO 27001 credentials and make sure your BAA is in place. Fourth, consider AI-assisted coding tools that validate codes and minimize unnecessary PHI exposure. Finally, don't skip regular compliance audits. Your peace of mind depends on it. A multi-specialty clinic in California was struggling with a 15% denial rate and growing security concerns in their outsourced process. After partnering with a HIPAA-compliant vendor using AI-assisted tools and EMR integration, their denial rate dropped to just 3%, and they went 18 months without a single HIPAA violation. Patient trust rebounded, and revenue flowed. That's the smarter way forward. Outsourced coding doesn't have to be a HIPAA risk. It can actually strengthen compliance while freeing your team to focus on patient care. For one family practice, our HIPAA-compliant coding team combined with AI tools reduced denials by 60% with zero compliance issues. The providers focused on care, and their patients trusted the process. So, doctors, if you're thinking about outsourcing your medical coding, remember this. With the right partner, it's not just secure under HIPAA, it's smarter for your clinic, your patients, and your future.